Welcome. I am absolutely thrilled to have you here today. In this explainer, we are going to decode the fascinating layers of the human mind. We're looking at a framework that completely revolutionized modern psychology, cognitive behavior therapy, or CBT for short. Basically, we're going to peel back the cognitive onion layer by layer to understand exactly how our minds process reality, why we sometimes get stuck in these awful cycles of distress, and most importantly, how we can actually rewire our own thinking.
Okay, let's dive into this. Do situations cause our emotions, or do our thoughts? I mean, it sounds simple, right? Most of us just walk around believing that situational triggers directly cause our emotional reactions. You get stuck in traffic, you feel angry. You lose a job, you feel depressed. We assume it's just basic cause and effect. But CBT asks us to completely flip that assumption on its head. The foundational philosophy of the cognitive model posits a really fascinating idea. It is not situations that directly impact your emotional, behavioral, or physiological reaction. Rather, it's one's automatic perception of that situation. Think about it. Two people can read the exact same difficult document at work. One feels totally hopeless and just stops reading, while the other feels annoyed but powers through it anyway. The situation is identical, but the emotional and physical reactions are entirely different because the lens they're looking through, their perception, is different. So here is our roadmap for today. We're going to cover the cognitive model, automatic thoughts and distortions, uncovering core beliefs, the CBT toolbox, and finally, the evidence for CBT. Section 1, the cognitive model. Let's look at where this incredible paradigm shift actually came from. Back in the 1960s, a psychiatrist named Dr. Aaron T. Beck was trained in traditional psychoanalysis. At that time, the prevailing wisdom was that depression was caused by unconscious drives, specifically hidden anger turned inward. But Beck, being a scientist at heart, actually tested this, and what he found completely disrupted the entire field. He discovered his depressed patients weren't suffering from hidden hostility, they were suffering from biased information processing. They had these highly negative, distorted beliefs about themselves, the world, and their future. They weren't broken by unconscious drives. Their distress was tied to how they were actively but inaccurately processing their reality. And this brilliantly illustrates the core mechanism Dr. Beck proposed. It's a three-step sequence. First, there's a situation. Second, that situation triggers an automatic thought. And third, that specific thought is what dictates your reaction. And it's really vital to note here that a reaction isn't just an emotion, like sadness or anxiety. It also includes your behavioral reaction, like isolating yourself, and your physiological reaction, like getting a heavy weight in your chest or a racing heart. To ground this abstract theory, let's look at a case study from our sources. Kevin, a 35-year-old construction worker. Kevin was fired for making a costly mistake. That is the situation. Now, when Kevin came to treatment for severe depression, he fully believed his low mood was strictly because he didn't have a job. But if we map out his actual cognitive model, we see a totally different story. The situation triggered the automatic thought, "I'll never get a job." It was that hopeless thought that triggered his emotion of deep sadness, his behavior of completely avoiding job hunting, and his physical fatigue. Section 2, automatic thoughts and distortions. This brings us to the second layer of our cognitive onions. Automatic thoughts are fascinating because they arise spontaneously, without any conscious reflection at all. Most of the time, we don't even notice them. We only notice the terrible mood that follows right after. Patients like Kevin have hundreds of these thoughts a day. Things like, "There's no use getting out of bed," or "I'm letting my wife down in every way." And even when patients do become aware of these thoughts, they tend to just accept them uncritically as absolute truths. They're looking at their experience through the darkest lenses possible, fully believing they are seeing reality clearly. Now, while everyone makes thinking errors occasionally, individuals experiencing psychiatric distress commit them at a much, much higher frequency. These are called cognitive distortions. We all make these thinking errors, I know I do, but individuals in distress commit them constantly. Kevin predicts a doomed future with fortune-telling. He assumes negative judgments from others without any real evidence through mind reading. And he engages in emotional reasoning, basically deciding that because he feels like a failure, it must be an objective fact. Identifying these biased processing errors is a massive first step in CBT. Section 3, uncovering core beliefs. Let's move to and see how this builds, because those surface-level thoughts don't just come out of nowhere. Just below our fleeting thoughts are what we call intermediate beliefs. These are the underlying rules, attitudes, and assumptions that dictate how we cope.
In Kevin's case, after he was fired, he gave up job hunting entirely and completely withdrew from his friends. Why? Well, because an intermediate assumption was activated. If I take on challenges, I'll fail, but if I avoid difficult tasks, I'll be okay. His sudden avoidance wasn't laziness. It was a subconscious coping strategy driven by his internal rules to protect himself from further distress.
And beneath those rules lie our core beliefs, the schemas. These are our most central, rigidly held ideas about ourselves, others, and the world. And they're usually planted way back during childhood. As a kid, Kevin actually felt pretty competent, especially in sports. But his parents had incredibly unrealistic expectations and were highly critical of him. They sowed a latent schema, a dormant core belief, that he was a failure. For years, he was totally fine. But psychology shows us that when a major life event matches an underlying vulnerability, like Kevin getting fired, that latent schema is triggered, making him view all of his current reality through that fixed, absolute failure lens. Section 4. The CBT Toolbox. Now that we've diagnosed the problem, how do we actually fix it? So, the crucial point is this. Cognitive therapy is not about making a patient dependent on a clinician for years and years of endless venting. Not at all. It is an active, educative, and highly collaborative process. The explicit goal is to teach the patient a specific set of skills so they can essentially become their own therapist. They learn to identify and modify their daily thinking and behavior on their own, specifically to prevent future relapses. One of the primary tools to achieve this is Socratic questioning. Rather than a therapist just telling a patient their thoughts are wrong, they use guided discovery. They ask strategic questions to help the patient evaluate the validity and utility of their own catastrophic thoughts. They might ask, hey, what is the actual evidence that this thought is 100% true? Is there an alternative explanation here? If a close friend had this exact same thought, what would you tell them? It guides the patient to do their own reality testing.
But CBT isn't just about talking, right? It's heavily focused on behavior through real-time experiments. For a depressed patient who is totally overwhelmed by a messy room, they might use a graded task assignment, literally just breaking the job down to 10 minutes of sorting mail to regain a quick sense of mastery. And for panic disorder, a therapist might actually have you spin in a chair until you're dizzy. I know, it sounds crazy, but this panic induction proves to your brain that the physical symptoms of anxiety will peak and then decline without actually causing a heart attack or a catastrophe. It's incredibly practical.
Section 5. The Evidence for CBT. For our final section, we are looking at the hard science. Now, what's really interesting about this slide is the sheer volume of data. There have been well over 1,000 randomized controlled trials demonstrating the effectiveness of cognitive behavior therapy. When tested head-to-head against other bona fide interventions, CBT consistently shows superior efficacy. And crucially, studies show it significantly reduces the rates of relapse after the treatment actually ends. The versatility of the cognitive model is truly breathtaking. It was originally developed as a short-term treatment for straightforward depression, but it has since been adapted to successfully treat a massive spectrum of conditions. From generalized anxiety and OCD, where patients learn to challenge their fusion beliefs and their inflated sense of responsibility, all the way to severe and persistent mental illnesses, like schizophrenia, where recovery-oriented cognitive therapy helps patients evaluate the beliefs that maintain their symptoms. And if you need physical proof of how powerful restructuring your thoughts can be, get this. Functional neuroimaging studies have shown that successful CBT actually alters brain function. When comparing the brains of individuals undergoing CBT to those taking psychotropic medication for conditions like OCD, social anxiety disorder, and depression, the results indicate that CBT causes remarkably similar physical changes in brain function. By consciously changing your thoughts, you are quite literally rewiring the physiology of your brain. Which brings us to our final thought. The cognitive model shows us that our distress isn't simply a reaction to the world around us, but a product of the internal lenses we wear. So I want to leave you with this question to carry with you. What automatic thoughts are coloring the lenses you are looking through today? Challenge them, test their reality, and remember that you absolutely have the power to change the narrative. Thank you so much for joining me for this explainer. Keep learning, keep questioning, and I'll see you next time.